Good morning. My name is Malynda Smith, and today my guest is Dr. Haley McDonald, an audiologist who has Hearing Specialists Incorporated, which is a division of ear, nose, and throat and facial plastic surgery, PC, an ENT practice in Willow Grove, Pennsylvania. Thank you.
Yep. No problem.
Dr. McDonald is a graduate of Salish University's George S. Osborne College of Audiology. Prior to beginning her graduate study, she graduated cum laude from the Pennsylvania State University with a bachelor's degree in communication studies and disorders and a minor in human development and family studies. Dr. McDonald is part of a new generation of patient-centered audiologists. Today we are going to discuss hearing aids and the rights patients have when they choose to be fitted for hearing aids. So welcome, Dr. McDonald, and thank you for being here with us today.
Thanks for having me.
Our first question is, how extensive is hearing impairment in America's patient population? And is it only older people who typically need hearing aids?
So, no, it's not only older people that need hearing aids. However, it's said that about 48 million Americans have some type of significant hearing loss. I particularly see a lot of adults. However, there are people in the younger generations, depending on, what they did or what they do, who do in fact have hearing loss. It is seen, though, that men, as opposed to women, are twice as likely to have some type of hearing loss. And people who do have hearing loss, once they decide, I think I have an issue, they tend to wait about 7 years before they actually do something about it.
Oh, wow. So at that point, the condition has gotten basically a little worse in terms of their hearing?
Correct. Okay. Yep, so their ability to understand speech, one of the main issues that people tend to complain about is speech and noise. So whenever there's any type of background noise, that's where the trouble starts.
Secondly, who determines that a patient could benefit from hearing aids, and how is that determined?
So, every patient's different. However, we do it together. First, they come in because they are starting to see some type of issue, or their family member is starting to see an issue, and they want to get at least a baseline. So we'll do a diagnostic test, which involves pure tone, air and bone conduction, tympanometry, which assesses the middle ear, OAEs if necessary, which are otoacoustic emissions, which help us to look at the hair cells along the cochlea. And then from that, we gather, does this person have a hearing loss? And then we discuss, do we think hearing aids or any type of treatment is right for you? So we do it together based off of, the person's complaints, what type of problems they're having in their everyday life, and kind of what the audiogram says.
So it's a combination of different factors.
Yep.
Okay. If a patient decides that he or she wants to move forward, what happens next?
So if we decide, hearing aids are the right option for us, we come in for a consultation. The day of the consultation, we discuss expectations, goals for your hearing aids, what you want to get out of a hearing aid, price, of course, because, hearing aids range in prices. And then we discuss, which manufacturer we think will work for them. I tend to choose, manufacturers based off of hearing losses and what the patient really wants out of their hearing aid. Some hearing aid companies I choose for power, some I choose for connectivity, others I choose just based on my experiences and how well people have been doing. Technology level, though, is always based off of the patient's needs and wants and what they need for their quality of life.
So is there a process where they actually fit it for the hearing aid? Does the ear have an effect on the type of hearing aid that they would use or need? Okay.
Definitely. So based off of, anatomy itself, yes. However, I tend to determine whether or not we need to do a custom fitting or a behind the ear fitting.
Okay.
Based off of one, dexterity. Are they able to get, that one piece in the ear and behind the ear? Or is it more simple just to do one piece? the technology chip inside is not different. It's more of a style preference and what will work best for the patient. But they always have a say, if someone really wants a custom option as opposed to a behind the ear, I mean, I'm not going to argue.
Okay.
However, sometimes certain fittings is better for certain hearing losses. So I'll mention it, but it always, depends on really what they want to in the long run, because if they don't like it, they're not going to wear it.
Right.
So, yeah.
I know that according to Medicare Consumer Guides, end quote, Medicare doesn't cover hearing aids because of the expense that comes with this avenue of coverage. Some hearing aid plans cost thousands of dollars, so covering them might have resulted in higher rates for all Medicare recipients. However, does private insurance ever pay for hearing aids, and if so, under what conditions will they do so?
Okay. So it really, really depends on what type of insurance you have. I have seen some insurances give kickbacks. I have seen some insurances say that we have this plan. If you want, this is part of your plan, and you can go here to get your hearing aids, and we'll give you some type of discount.
Okay.
I have seen insurances that are associated with things called third parties, which is basically a sector or a company where the patient can order their hearing aids at a lower price, and the provider, takes care of them under that certain company's specific guidelines. So sometimes it's good for the patient. However, the provider is restricted in what they can actually do for the patient sometimes. So yes, there are ways around it. However, every practice is different.
Okay.
They set up their goals, and they set up their fee schedules, and they set up, what you can provide the patient differently. So it really depends on the place and your insurance company.
Right. That's what I was going to ask also. Is there some sort of payment plan that patients are able to go on in order to finance the hearing aids?
So, like I said, it depends on, where you're going.
Okay.
Here at our practice, we offer 12 months no interest financing through Wells Fargo. So
Okay.
that is basically you're opening up a credit card through Wells Fargo.
Okay.
They pay up front for your hearing aids, but you can break that payment down into 12 months.
Okay.
So that is an option that's available here. Other places, it just depends on where you go.
Finally, since hearing aids are a choice for a patient, what are some pointers you can give to our audience about how to approach the experience of considering hearing aids?
Okay, so first I highly suggest having a full diagnostic audiogram or test done by an audiologist. Doesn't really matter where you go, as long as you're getting that full battery so you can get the full picture. It's completely different than a free screening. You're kind of eliminating certain aspects of what goes on with hearing loss. Make sure you're comfortable with your provider. I know some people, they want to choose to go certain places because some things can be cheaper. But you really have to weigh the odds of, do I want to be a customer or do I want to be a patient? So those are the odds as well that you need to weigh. Other things you want to think about is you really need to treat hearing loss like you treat your overall health. There have been studies recently come out that hearing loss is associated with earlier stages and earlier onset of dementia. What they've been saying is that, hearing loss causes the brain to, shrink. In that area of the brain, if you're not using it, you kind of lose it.
Right.
I actually heard this great analogy of how we kind of think of the brain and how hearing loss is associated with dementia. You can think of your brain as a fuel tank. When you have hearing loss, your brain uses a lot of fuel to help make sure that you're hearing and make sure that you're picking up. It's using a lot of juice, which kind of steals things away from cognition, memory, and then other things that you have to do throughout your daily life. So just keeping in mind that hearing loss, you feel like you might be able to slide on by, but we don't just hear with our ears. We listen with our ears and we hear with our brain. So we got to keep it sharp and treat hearing loss like you would treat anything else.
Thank you for your time.
You're welcome.